What's going on, guys? Tony Maritato here, licensed physical therapist. I'm just getting ready to start a day of patient care, but I wanted to come on to answer a question that came in from the Facebook group, Total Knee Replacement for Kind Support Group for Kind People. Total Knee Replacement Support Group for Kind People. So Sandy was asking about some sensitivity she's having under her skin. Now, I don't have the full details, but she was basically saying that she feels this kind of pulling, ripping, tearing sensation under the skin. And I want to talk about cupping as a strategy that might help to desensitize that area. So let me spin the camera around. These little cups, I just got these. These are brand new. Show you. So these came from Amazon. Here's the packaging. And I will put a link in the description below. They come in two sizes. We've got these bigger ones. We've got these smaller ones. I'm going to use the smaller one. This is typically what I'll use for my post-op knee replacement rehab. And what I usually recommend is, let's say, for example, somebody's having sensitivity in this area. So the first thing we want to do is we want to establish what do we think is causing the sensitivity, right? We've got the skin. Now, I know that I haven't had a knee replacement, but I'm doing the best that I can to kind of help determine what's sensitive. So you can see how I'm pinching and lifting the skin. You can imagine that when the skin is disrupted, it's pulled to the side. When it comes back together, there could be some adhesions that form into this area. First thing is, I don't believe this cupping does anything to, quote, break up scar tissue. But what I do believe it does is it does create mechanical lift on the skin using the cup. So I'm going to squeeze it, put it in the area, and let it go. You can see that little bubble that forms under there. The cup tends to work better when there is lotion on the skin, but I don't have any lotion at the moment. So I squeeze, I stick it on, it creates that little lift. I can mobilize in like a circular pattern. I can lift, I can go up and down, side to side. When I remove the cup, so I'm going to let it suck on there for a second. When I remove the cup, you can see a little bit of redness. Now that redness is basically because of the negative pressure, and it's drawing blood into the superficial capillaries. So the blood vessels that are superficial in the skin, yes, those are getting increased blood flow, but it's temporary. I never leave a cup on, whether it's healthy tissue or recovery tissue. I never leave a cup on long enough for it to cause a bruising mark. I believe that the main benefit of cupping is to create lift in the skin. If you didn't have the cup, you could absolutely grab the skin. You can't use lotion when you're using this pinch and lift technique because your fingers will just slip right off. But if you look at the way skin should be, now, I don't have a swollen knee. If your knee is swollen, you're not going to be able to grab the skin quite so easily. But regular, healthy, normal skin outside of surgery, it should be relatively loose. You should be able to lift it up. Over the kneecap, over these areas, even with a post-surgical incision, since the swelling is going to make the skin so tight, what I could do is a very gentle pinching motion. So I'm not actually pinching and lifting, but I'm gathering the skin. And again, you can kind of see how if there are little adhesions underneath there, they would be receiving tension from this. But these little cups, they're like, I don't know, $3 or $4 a piece. Maybe you get a pack of, I think I got a pack of like 6 of them for maybe $12. But that is just a tool that creates a handle that allows me to lift the skin. And if there's